Good evening, guys. I've got discussion C for you. Title is Interpreting Home Care. The hospital comes home. This phrase is almost certainly a tagline or section header introducing a modern healthcare model known as hospital at home. It signals a shift from seeing home care as limited to basic support like meal prep or light nursing toward positioning it as a full clinical alternative to hospitalization, where advanced medical services are delivered directly in the patient's home. What it usually conveys. Scope of care goes beyond traditional home health. It includes acute and post-acute interventions that would normally require inpatient admission. Services offered in-home diagnostics, blood tests, portable imaging, point-of-care devices, IV therapies, oxygen support, wound care, and medication management, rehabilitation services, physical occupational speech therapy. Telemedicine, consults with physicians and specialists, monitoring, continuous or scheduled remote patient monitoring using connected devices with nursing oversight and escalation protocols. Care team, a coordinated network of physicians, nurses, therapists, pharmacists, and social workers who blend in-person visits with virtual rounds. Why this framing matters. Patient-centered experience. Care happens in familiar surroundings, reducing stress and exposure to hospital acquired infections. Patients often feel more autonomy and comfort. Clinical outcomes. Studies show hospital at home programs can achieve equal or better safety and quality outcomes for selected conditions when supported by strong protocols. Equity and access extends hospital capacity to rural or underserved communities. minimizing travel burdens and caregiver strain. System efficiency frees up hospital beds, reduces readmissions, and lowers overall costs by avoiding prolonged inpatient stays. Surrounding page content often includes eligibility criteria, lists of conditions suitable for home hospitalization, e.g., congestive heart failure, exacerbations, COPD flare ups, cellulitis, certain infections. Workflow explains how patients are referred from from ER or inpatient units, admitted to home care, monitored daily, and eventually discharged. Technology stack, remote monitoring devices, secure communication platforms, EHR integration, and 24-hour nurse hotlines, safety protocols, emergency response pathways, medication safety checks, infection control, and fall prevention strategies. Insurance and payment models, coverage details, bundled payments or value-based care arrangements, caregiver support, training for family members, respite care options, and clear role definitions in the care plan. Outcome matrix, data on patients, satisfaction, length of stay, readmission rates, and complication statistics. Practical takeaway. Home health care. The hospital comes home, signals a clinically advanced healthcare program that brings hospital grade services into the home. It's not just about comfort, it's about replacing inpatient standards of care through multidisciplinary teams, technology, and rigorous safety protocols, making home a viable site for healing for many conditions. Would you like me to sketch out a sample patient journey from ER referral to home discharge to illustrate how this model works in practice? Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. Till then, Gator Wellness, have a good night, folks.